Welcome to the BLUF,
where CDP gives you the bottom line up front. Hello and Happy New Year, everyone. I'm Dr. Jenna Ermold, Assistant Director of Training and Education for the Center for Deployment Psychology at the Uniformed Services University. And today I'm excited to talk with Dr. Abigail Ankow, Consultant for the National Center for PTSD and Deputy Associate Chief of Staff at the VA San Diego, and Dr. Brittany Hall-Clark, who is also a consultant with the National Center for PTSD and Assistant Professor at UT Health San Antonio. They will be presenting the webinar, The Elephant in the Room, Treating PTSD When Clinicians Have Strong Reactions to Patients' Sociocultural Views, on January 19th from 12 to 1:30 Eastern Time as part of our CDP Presents webinar series. So welcome to the BLUF. We're so excited to have you.
Thank you for having us.
Yeah, happy to be here.
So as we ask all of our guests on the BLUF, what is the bottom line up front regarding treating PTSD when clinicians have strong reactions to patients' sociocultural views?
So the bottom line is that so much has changed over the past 2 years, and the COVID-19 pandemic really began and amplified so many overlapping personal, social, medical, and political and economic crises that are really shared crises. And what we are hearing is from clinicians who are a few things. They're seeing more patients. They may be working in ways that are different, a lot of telehealth, maybe when they weren't before. So the work experience is difficult and perhaps more difficult. And there are just a lot of strong feelings. There have been a lot of strong feelings over the past 2 years about the sociocultural concerns and stressors. And when there are, with the type of work that we do, we should expect patients to bring those into the room. And we should also expect our clinicians, who are people and perhaps might be feeling a little burned out, that they may be having reactions. And that's what we mean by the elephant in the room. So that there might be reactions, and what we were hearing is some clinicians may be having reactions to something that some sort of belief that their patient or client may be sharing, and they're wondering what to do with that and how can they continue to move forward with providing care. And so that is really the bottom line for our talk, is really to address that and to provide folks with some strategies.
That's fantastic. And maybe Dr. Hall-Clark, you can talk to us a little bit about what to expect, our participants can expect as takeaways, strategies from this webinar.
Yes, absolutely. So as Dr. Ankow was saying, we'll highlight some of the recent events that inspired this talk, that have brought up different sociocultural views in therapy. We'll also talk about some specific strategies for assessment and case conceptualization, as well as some clinical strategies, how to integrate this into evidence-based treatments for trauma-focused therapy.
Well, it is definitely one not to be missed. We're very glad to kick the new year off with this incredibly important and timely topic. So we hope that you're able to join us on January 19th from 12 to 1:30 Eastern Time for The Elephant in the Room, Treating PTSD When Clinicians Have Strong Reactions to Patients' Sociocultural Views. And please also look out for an email with our Center for Deployment Psychology CDP Presents Save the Date flyer that's going to list all of our monthly webinar series for the entirety of 2022, which we're excited to send shortly. We cannot wait to have a great year together. So thank you so much again, Dr. Ankow and Dr. Hall-Clark.
Thank you. We'll see you there.
Yeah, looking forward to it.
Thanks for listening to The BLUF.
and be sure to check out our website, deploymentsite.org, for upcoming trainings, tools, and resources to help you better serve those who served.